I think this is one of the biggest scandals in psychiatry right now. 80% of the visits to psychiatrists are for depression and anxiety. 15% of Americans are taking an antidepressant. Over 20% of the population is taking a psychiatric medication on a daily basis. And we have like a healthcare system that doesn't really support people.
How do we fix it? Please introduce yourself.
So I went to medical school and then I did a psychiatry residency. I then did a fellowship in psychiatric clinical trials at Janssen, which is the pharmaceutical branch of Johnson & Johnson. I then worked at the FDA as a medical officer reviewing the safety and effectiveness of psychiatric drugs for the US market. I actually believe we're kind of in one of the biggest scams of the century with how we're using these medications. We've had an industry pour billions of dollars into platforming certain speakers and promoting certain messages about these mental health problems. They're biological, they're common, you need to treat them with medications, and anyone that says otherwise is actually a dangerous person. There was a really notorious case from the 90s about a gentleman called Don Shell. He had been exposed to fluoxetine, which is Prozac, before, and he became agitated on it, and his doctor took him off it. I think he went and saw another doctor a few years later and they put him on Paxil. And within a week, he kills his wife, he kills his daughter, and he shoots his granddaughter dead. And then he kills himself.
Welcome back to the Real Talk with Zuby podcast. On today's episode, we are going to be having a very important conversation about a very important topic. We're going to be talking about mental health. We're going to be talking about psychiatric drugs and everything in our society, culture, and medicine around that. Today's guest is a board-certified psychiatrist, and this is Josef Witt-Doerring. Welcome to the show, man.
Hey, thanks for having me here.
Happy to have you here, bro. First of all, for my listeners who aren't familiar with you, your credentials, and what it is that you do, just please introduce yourself.
I will. Yeah, because every time I talk about this, they go, there's no way this guy could actually be a mental health professional. And so, so I went to medical school and then I did a psychiatry residency. I then did a fellowship in psychiatric clinical trials at Janssen, which is the pharmaceutical branch of Johnson & Johnson. I then worked at the FDA as a medical officer reviewing the safety and effectiveness of psychiatric drugs for the US market. And then went to a couple other pharmaceutical companies before ultimately deciding I didn't believe in the way we're practicing psychiatry. I actually believe we're kind of in one of the biggest scams of the century with how we're using these medications. And since 2020, I've had a private practice called the Taper Clinic, multi-state in the US. We're in 14 states. It's a team of 12 now. And we essentially help people come off psychiatric medications. Yeah.
How common is the usage of psychiatric medication in the USA?
Yeah, it's massive. Over 20% of the population is taking a psychiatric medication on a daily basis. I would say around 15% of 15% of Americans are taking an antidepressant. And so it's something that everyone knows someone on psychiatric medications. Either they themselves are taking it or someone in their immediate family or like close friends. I mean, it's that common.
How did it get up to 20%? Because just common sense tells me that that's really, really high. I travel around the world a lot, and I would not be shocked if that's possibly the highest in the world, if not close to it.
Yeah. So how did it get this bad? Well, I think intuitively for a long time, people, when they... I'm going to talk about anxiety and depression because mental health can be kind of complicated. We have like bipolar and schizophrenia,
sure.
But 80% of the visits to psychiatrists are for depression and anxiety. So let's just focus on that. For a long time, people used to conceptualize these issues as understandable reactions to life, you know, relationship problems, problems at work, sometimes even like health issues. And it's kind of like what your grandma would say to you, you know, and how she would think about it. But for the last 3 decades, we've had a big push to reconceptualize mental health problems as brain problems. And the analogy that they use is that when you're anxious or depressed, you have a chemical imbalance, and it's like someone having type 1 diabetes who needs insulin, and you should therefore take a drug. Now, this was kind of introduced under sort of like a compassion excuse, saying, you know, it's a really good thing to talk about mental health problems as medical problems because there's a bunch of like guys out there who are going to feel ashamed to come forward and say, hey, I'm struggling right now, because they're going to, they call it stigma. They're going to say, well, that's a moral failing. I'm a weak person. I shouldn't come forward. And so they kind of introduce this white lie to say, well, it's good to talk about it in medical terms because it's going to make more people come forward.
When you say they, who's that?
Pharmaceutical industry and American Psychiatric Association, essentially, which is a professional guild that has an interest in people thinking positively about drugs and psychiatric treatments. And so while that is true, that, saying these problems are mainly medical problems, the kind of sinister underlying motive that I think a lot of people forget is that there's actually a really big commercial interest in promoting a version of looking at mental distress that it's biological, especially if you're going to gain financially from it. And that's what's happened. We've had an industry pour billions of dollars into platforming certain speakers and promoting certain messages about, mental health these mental health problems. They're biological, they're common. You need to treat them with medications. And anyone that says otherwise is actually a dangerous person. They're someone who's trying to scare people away from mental health issues, and they should be silenced. They should face some, professional retribution. They should have their medical license taken away. And so what's happened essentially is the public, especially in the US, which is the epicenter of drug company marketing, they've just been marinating in this soup that's actually just been misleading them about the causes of mental illness. Now everyone thinks they have these biochemical imbalances and they need to be on the drugs. Yeah.
Where did this concept of chemical imbalance come from? Because I've heard that my entire life. Even as a child, it struck me as never sort of passed my BS detector.
Sure.
But where did that concept come from? Because it just gets repeated and repeated and repeated.
Back in the 1950s, researchers noticed that when they gave a drug called iproniazid to patients with tuberculosis, it energized them. And then they discovered that the reason it did this was that it was boosting something called monoamines, which is essentially serotonin, norepinephrine, and dopamine. Now, because of that, they said, why don't we use these drugs and we give them to patients with depression and see if it helps? And it did. It energized them. And then because of that, they had this kind of reverse logic where they said, well, maybe depression is actually a problem with serotonin, dopamine, norepinephrine. And that was essentially the reasoning. The reasoning was the drugs work on this, and so the drugs work on this, and so the disease must be caused by deficiencies in those monoamines. But that's kind of doesn't really make sense, because I think for most people, they might just say, well, this is just a drug effect. We're just giving someone something that is masking the symptoms with the drug effect that it's causing. But that's not a commercially popular message, right? And so if you have an agenda to kind of promote one version of reality, you're going to throw a lot of resources behind that. And that's what happened. Now, you might be thinking, well, what kind of evidence is there that there even is some kind of chemical imbalance there? And a really big really big systematic review by Joanna Moncrief came out a couple of years ago, where they reviewed all of the studies to look at this. And so, for instance, they looked at depressed and non-depressed patients, and they would remove cerebral spinal fluid by doing a spinal tap, and they'd say, is there any difference in the metabolites of serotonin or any of these other chemicals? No difference. They would do autopsies on brains from people who would take their life by suicide, who were depressed, and they would compare them to non-depressed brains. And there was no changes in the receptors when they did it that way. And they can also do brain scans now, where they can actually look at the way the brain lights up when people are alive, people who are depressed and non-depressed, and there's no difference. So every time we've tried to find a biological way to differentiate depressed or anxious patients from, quote unquote, normal people, we haven't been able to find a biological marker for that.
Yeah.
And so it's just a lie.
Yeah. I mean, it strikes me as crazy because, I mean, something like a chemical imbalance, if that's the case, that should be quite easily provable by biological markers. I'm no expert on anxiety or depression. It's not something I've personally ever been through. But my understanding is that most diagnoses, well, there's a lot of self-diagnosis going on, but even the real diagnoses, it seems to be more like a questionnaire.
That's exactly what it is.
That's what it is? Okay.
Yeah, yeah. And so there's like this kind of thinking that, that these questionnaires are scientific. Like to get diagnosed with depression, you need 5 out of 9 symptoms on a questionnaire, essentially. Like we don't use lab tests, we don't use brain scans or anything like that. And then people sometimes think, well, it's called major depressive disorder and there's these symptoms there. This must have some kind of like logical underpinning about how they came up with these symptoms. Like, maybe we can, they found something in the brain and it kind of routinely led to these 9 symptoms and it's backed up in some way. When you look at the history of the DSM, these symptoms and these checklists, they were just voted on. They just got a bunch of people into a room and they were just like, hey guys, what do you think characterizes depression?
Yes.
And they would say, sleep problems, anxiety, low mood, lack of interest and, some other things, feelings of guilt.
So subjective.
And they were just like, okay, so those are the symptoms. And okay, so what do you think we need to actually diagnose someone? Well, I think maybe 5 symptoms. Why not 6? Why not 4? Well, 5 seems about right.
It's just like more than half.
Yeah, yeah. And that is the same with every psychiatric diagnosis in the book.
Really?
Yeah, there are no objective. That's what makes something a psychiatric diagnosis, is that there's no like physical underpinning to it. Because as soon as something actually has a biological cause, it becomes neurology. It becomes Parkinson's or Huntington's or multiple sclerosis. Like we can see the lesion there. Now, this is not to say that, like, I don't think there's any biological underpinnings in psychiatry. Like I think with things like schizophrenia and bipolar, we're probably going to find something eventually. Because to me, logically, it makes sense that.
So even with those, there aren't biological markers that
we found.
Wow, that's interesting. I didn't know that actually.
Yeah. And so they're likely polygenic, which means it's controlled by multiple different genes. And so it's really hard to kind of grapple with it. But to me, it makes sense that for some of these conditions, especially the serious ones that are really obvious to tell, like a schizophrenic or someone with bipolar, like there's got to be a reason why, you could get like 50 people and you could put an immense amount of stress on them. 49 of them become anxious and depressed. One of them goes on to develop paranoia or mania or some of these extreme emotional states. Like to me, there must be some kind of biological underpinning for those. Yeah. But most of what we see these days, depression and anxiety, I don't think it's a chemical imbalance. I actually think it's just grounded in a lot of life stresses and actually physical health problems as well.
Thanks for watching this video. If you haven't already, make sure you subscribe to the channel for more full Real Talk with Zuby podcasts and clips. Thank you. There's also a mimetic component to it. I think particularly in the Western world, because it's similar in the UK. I don't know if the antidepressant usage is as high as it is in the US, but it's certainly very high. But it seems to me the more conversations there are around mental health, anxiety, and depression, the more people think that they have it, especially young people. It seems that at the extreme, and I'm sure you've seen this because you spend a lot of time online and on social media, at an extreme, there can be friend groups, particularly friend groups of young women or girls, where it becomes essentially a trend.
Yeah.
Where if you're just normal and you don't have anxiety or depression or PTSD or this or that, then it's almost like then there's something wrong with you then. There are these conversations go on where it's like to fit in or to sort of empathize with people, you almost have to, people feel like they have to pretend that there's something wrong with them. And then in many cases, I mean, it sounds like it's not too hard to get a diagnosis, but people are also just diagnosing themselves. People are taking just normal everyday feelings. And I call it pathologizing the human condition.
Yeah.
So before, when I was a kid, someone would say they're sad. Now that same kid of that age would say they're depressed.
Yeah.
Someone would say that they're worried or they're concerned. Now people say I'm anxious or I have anxiety.
Yeah.
Before people would say, oh, I had a bad experience and, I'm in a bit of a slump, but now that's PTSD, that's depression. And so it seems like everything is the language of therapy and psychiatry has sort of crept into the everyday vocabulary to the point that I feel like a lot of people think they have conditions that they don't. And maybe, through the power of the brain, that can even, make people really believe that they do.
I'm so happy that you mentioned this and that you actually notice this going on, because it really disturbs me. The other example I can think of is like, instead of being like quirky, you're now neurodivergent.
Yes. Great example. Great example.
That's like the other one.
Look, not to even intentionally push the podcast in this direction, but even just quirks and personality traits, when people are like, oh, that's, you're a different gender, right? You're in the wrong body. Before that girl used to be a tomboy. Now it's like, oh, maybe she's actually a boy trapped in a girl's body, right? Like at the extreme, it's like, oh, that's gender dysphoria now. Yeah. And it's like, no, that's just someone's personality trait.
Yeah. And I don't mind you going in that direction, because I see it kind of similarly.
Yeah.
The transgender issue, and then also where it's like, there could be legitimate problems going on in your life, some kind of issues that are making you feel like you aren't the right gender and you're uncomfortable in your body. And then so you go, and then someone tells you, oh, you might be the wrong sex. And you go, yeah, okay, that's great. And with anxiety and depression and these issues, like something's not going well in your life. And then they say, well, maybe you have a chemical imbalance. But it's like, no, there's actually like legit things going on like in your life that you need to care about. And the other thing is that we are such a lost society right now. I think I think a lot of people are lacking meaning. I think there's a lot of social isolation going on. And so, yes, you absolutely start getting these like communities which like bandy around things like mental health diagnoses, and there's almost like a weird social currency in a way. Like I know, especially in the US, there's like oppression politics here.
Yes.
And it's like, if you're in a stigmatized group, especially in left-leaning media, a lot of the times they will celebrate you and they'll say, there's something, there's something really good about that. And you need to kind of bandy together and fight. And so people will find community in having like mental health disorders now. And so, there's a whole thing going on there with TikTok where you have people man, they have their drugs in their like descriptions
in the bio.
They're just like, I take Lexapro and Zoloft, live, laugh, Lexapro, or I'm a
Did you just say live, laugh, Lexapro?
Yeah.
I've never actually been on TikTok ever, intentionally, but I've seen so much from it from being on other platforms.
Well, that's what you'll do when you're going back to Dubai and you're kind of like sitting there. You can go TikTok and you can search hashtag live, laugh, Lexapro. You can do hashtag Lexahose as well.
Wow.
You can go hashtag bupropion baddies. And,
oh my gosh.
Yeah. And so there's, you can go on like do you know Etsy? Are you
yes,
familiar?
I do.
Yeah. So you can go on Etsy and you can get like live, laugh, Lexapro like themed shirts as well.
Wow.
Like there is a whole cottage industry about like reinforcing that you're taking psychiatric medications. And I'm going to promote this to the world because in my community, this is like this is like cool. I'm like, I suffer from a mental health problem. I'm mysterious. There's something kind of and oppressed in some way. There's a complexity to me.
Wow. China is loving this.
Yeah, they are. And in my dark moments, sometimes I'm like, oh, they're pushing this out in the algorithm. They're trying to make people gender confused. They're trying to make everyone think that they have like mental health problems. And so,
what a good way to destroy a generation.
It could be happening, Yeah. But I bet they are.
Yeah, I mean, I want to actually ask you some questions that are sort of basics, because we throw these terms around, anxiety, depression, people use them. What, from a psychiatric professional perspective, what is the actual definition of depression? And then you can do anxiety as well.
Yeah, it's that 5 out of 9 symptoms.
Okay.
Yeah, like and then anxiety is the same. There's like a list of symptoms, and if you have a certain number of them, then you have anxiety.
Do you know the list off the top of your head, or most of it at least?
I think it would be things like anxious, ruminating thoughts, like muscle tension, like insomnia is a common symptom as well. I mean, we could probably pull it up and on those. It'd be really easy to throw it on the screen in editing, but like it's just DSM criteria, generalized anxiety disorder, or DSM criteria, major depressive disorder.
Given that one's called major, is there minor depressive disorder? Is that a thing?
No, they just call it major.
It's just major.
There's just major depressive disorder. Yeah.
Interesting.
Yeah.
Wow.
And there's this whole like weird semantic confusion thing happening here, which I think is worth mentioning. It's like because people just say, "Oh, I'm depressed," right? And that used to mean like I'm just like sad.
I feel sad. Yeah.
Yeah. But now when people say it, it's like, "Oh, I'm depressed with a capital D." It's like a medical condition, and there's like
I have depression.
I have depression. Yeah. Like I have this thing. As if it maps onto some biological thing, but all it means is, yeah, you have 5 out of 9 symptoms on this list that a bunch of people voted on.
That's so interesting because depending on your current mood and what's going on in your life at any given time, I mean, I'm the most happy, optimistic, depression-proof person that might exist out there, and I would wager that on certain days, with my own subjective reasoning, I could argue that I have many of those points. I mean, difficulty sleeping, sure. I could do that one. Ruminating thoughts, yeah, sure. I think a lot. Muscle tension, 100%.
Yeah.
I don't know what the other ones are, but I mean, it seems
low
like
mood,
low mood,
lack of interest in things that you're normally interested in, feelings of guilt,
sometimes.
Feelings of hopelessness. Like,
yeah, I mean, but sometimes, right? I can, I could be feeling that on Wednesday because something happens in my life, or something just really bums me out.
I know you have a cold right now, so you might be feeling a bit of fatigue, which is another one of those symptoms.
Okay. Yeah. I mean, it just seems like crazily easy to. Is it really that easy to get a diagnosis? Are there no guardrails?
It is so easy, and this is one of the things that I wage war against in my work. Is that the majority of psychiatric medications are dished out by family medicine doctors in 15-minute visits. A lot of the times when they're just like, they will give a patient a questionnaire to fill out in the waiting room, and then they'll come in and they'll say, "Okay, you've got depression. Hey, would you like to take psychiatric medication?" Yeah. Now there's this. I hope I don't lose you here, but there is an important point. Like people talk about depression as if it's this mental illness, this problem which is an explanation in and of itself. Like, I have depression, I have this issue, but it really is it's just a symptom, and it's a symptom coming from something else. But you kind of, when you're just like, I have major depressive disorder, it's just like, I just have this medical problem. People stop asking questions, and this is why it's so dangerous how these diagnoses are given out, because the doctor goes, okay, major depressive disorder, okay, that's legit. We've got, and then they give this medication, but the kind of care that you would want for like anyone that you loved. I don't know. Do you have kids, Zuby?
Yes.
Yeah. Like, think about like your kid. You would want someone to spend time with them. You'd be like, what's going on in your life? Like how are your relationships? Like, how are you doing in school? Tell me about like your diet, and like, are you moving your body? Are you getting out in the sun? Are you doing things? None of that happens.
It's so crazy to me.
Like, it's just diagnosed off this checklist. And then they say, okay, well, we have an SSRI. It's approved by the FDA. They say it's safe and effective. And then so they'll give them a medication, knowing that it's kind of been blessed by the FDA, and they say it's safe. And this is totally normal, standard medical care in the US, in the UK, in Australia, and in most developed countries. And it has become set up like that because it is incredibly efficient for doctors. And so there's this like it's easier for a family medicine doctor to help that person by just saying, okay, yeah, you're depressed based on this checklist and we have a drug for that, than taking the time to get to know them. That's not an economically viable way to do things. You make half as much money, at least in the US, and I think it's in the UK, based on the way we do insurance reimbursements. you get paid more per unit of time if you're just churning people out. Like if you see like 4 people in an hour, that's worth more than seeing 1 person in an hour, obviously. And so they get this really transactional care. It makes the doctor more money. It makes the hospital more money, and they have
the pharmaceutical company,
and it makes the pharmaceutical companies more money.
I mean, it's such an obvious perverse incentive there. And it sort of boggles my mind that more people don't see that and at least question it, right? It doesn't necessarily mean that the entire thing is a scam or that 0% of people should ever take any of these things, but it's so obviously overprescribed, just intuitively, just my common sense, looking around the world at different places, looking at history compared to now. I mean, these numbers just keep rising. They keep increasing as life gets more comfortable, as it gets easier to survive, as you look at countries that actually have more wealthy populations and less real struggles for survival, the rates of these things are shooting up. Whereas, again, because it's so much is self-diagnosed. It's not like there are many diseases or conditions where there are just very objective standards and measurements. But with something like this, it just becomes so subjective. And I mean, if 20% of the population is on some type of daily, not just what's the term, psychiatric medication, that's I don't know. Like I don't see how everyone can't just see that that's obviously an overprescription. Like it doesn't make sense that 1 in 5 people needs to be taking something just to quote unquote feel normal. Yeah.
It's like 20% of the population isn't walking around with broken brains, right?
No, how could they?
Yeah, and so we've had, and there's some stats on this as well. I know that since the early 90s, the use of SSRIs has increased 5-fold.
Wow.
We have more psychiatric disability than ever before. We have more people who are anxious and depressed. We have higher rates of suicide and higher rates of teen suicide. It's not only is it overprescribed, it's just not working at a population level. And I would implore people who are listening to this right now, and also to yourself, to just be like, intuitively go back to the way your grandma would have reasoned about this. And it's like, how could that ever work? Like if you have people who are anxious and depressed, like for legit reasons, and the way you treat it is to like mask it with a drug and not actually help them with the problem. Like, how could that ever be like a good solution for helping the mental health of a country? You can't just sweep shit under the rug. You actually have to like address it and fix it.
I think this is where that whole like chemical imbalance lie just got so entrenched and became so powerful. Because if you think of so many other areas of life, it's very obvious and intuitive to people that you have to get to the root of the problem, right? So if someone were having problems in their relationship or their marriage, and you said, "Oh, just avoid conversations. In fact, even physically, just stay away from each other, and you won't." Everyone would be like, "Well, that's horrible advice." If someone had a gunshot, and you're like, "Just take this very strong painkiller," right? Just take the pain, and we're not going to address the wound.
Yeah.
Right. Like you're hurting because you've been shot. I was like, no. We'll just address the pain. Like that would obviously be medical malpractice.
Yeah.
In any other situation, I just think people would know, okay, you have to look at the root and get to what is causing it. You can't just deal with the symptoms and try to like numb it or avoid it. But as my understanding is how lots of these medications work, it's essentially numbing people's emotional range. So that instead of operating within this full window, the window is now narrowed. And so sure, you're not going to feel as low. You're probably not going to feel as high either during good times. But then of course, even common sense would tell me someone's going to develop a type of resistance, because people develop resistances to like everything. The same reason, smokers or drinkers need to keep taking more and more and more if they go too far. The same thing's going to happen. Your body's going to be like, oh, okay, this dose is no longer doing it. It happens with caffeine.
Yes.
Right? It happens with everything.
And so, I mean, another reason why the chemical imbalance has been such a popular myth is because it's good PR, because if you were to say to people, hey, like taking these drugs, like they're just drugs, you know, and they mask your symptoms, and there's and some people will experience that as therapeutic. That's bad PR, because all of a sudden people will associate it with what you said, the fact that these drugs wear off over time, which is totally true. Like, and that's what I noticed when I was in my clinical practice and I was going through my residency. It's like, you don't just put someone on 5 milligrams of Lexapro, which is the starting dose, and they like just sail off into the distance and they're fine. Like that person is back in like 6 months and they're like, it's not doing anything anymore, you know? And then so you go to 10, and then within like 2 years, they're maxed out on the dose and they're having side effects, but it's not really effective anymore. And then you add another drug on. And again, the doctors aren't telling people like, hey, you know, your brain has just adapted to it because like our body wants to maintain homeostasis. It wants to stay in balance. It doesn't like being chemically altered. They don't say that and say, you know, this is the end result. They say, oh, you know, you're treatment resistant, or your depression is evolving in
Give
some
them
way.
another condition.
Yeah. And so they give them another drug.
Yeah.
And that's why you end up in a situation where people are on like 5 different drugs. They're still like massively psychiatrically disabled, or they're getting worse. And I think it's really intuitive to see that if you're just like, yeah, what else could be the outcome of just using drugs, which the body pushes against?
Why is this? Yeah. Here's a question. And I have my theories on this, but like, why is this controversial? Why are so few doctors in your field saying this? Why are people afraid to have this conversation and bring up this discussion? Something I found with depression especially is like people cling to it. It's like a sort of a comfort blanket for a lot of people, right? Like they identify with it. Maybe that's the best way to put it, right? It's not just you. I would think that if I felt depressed or I thought I had depression, and someone was trying to convince me that like I actually don't have a chemical imbalance and actually I can overcome this without the need of outside drugs, and I could, you know, change things in my lifestyle that would make me better, I would think that would be good news to me. But it seems that for many people, whether they themselves consider themselves depressed or maybe they know they're close to someone who is or something, like people are so sensitive and sometimes even quite aggressive about maintaining, no, absolutely, I have this, I have this thing. It's like they don't want to let go of it or even entertain other modes of thinking that aren't just, okay, you've just got this and therefore you need to take this thing. What do you think is going on there? Why is this particular topic so difficult for so many people to just discuss and hash out?
I mean, a lot of having like a brain illness, like being able to say, you know, this is the reason you're having these problems, is a lot easier to swallow for a lot of people than like the real issues going on in their life. And I know that probably sounds insensitive, but like people are suffering from real issues. Like, I mean, they may be really struggling with social isolation. They don't know how to talk to people. They don't know how to interact with people. They may be in terrible relationships and they have no idea how they're going to get out, and they're afraid of being alone. They may be, you know, they might have gone to school for the wrong thing and they're doing a terrible job and they can't get out of it now because they have to support themselves or they're in debt. And so you can have like, your life can be a shit show. I mean, you could have like terrible metabolic health and insulin resistance and obesity and all of these other things going on. And so I also think for some people, it's like, where do you even start? And, you know, and then we have like a healthcare system that doesn't really support people, because I know in your bio you say coach. And so I imagine you've coached people before.
Many, yeah.
Like a really great coach or a helper is able to break a complicated problem down into like little steps that like a person can handle, so they can build up some confidence over time. We don't do that for our patients with depression and anxiety. And so the help that they have available to them is a family doctor who has 15 minutes, maybe a psychologist that could get them in like once every couple of months or something like that. So no one is even there to like show them a way out of it. And so when you're sitting there and your life is in pieces and you don't really know kind of how to start putting it back together, and no one is helping you do that, I think there's a lot of comfort in being like, it's my brain that's the problem. I don't really have agency over this because I don't even know which way to go with it. But I'd love to hear your thoughts as well. I know you said you had kind of a hunch about why it would be so hard to wrestle that away from someone.
I think it's the same reason that people latch onto and get protective over different forms of victim mentality. So there are people who want to believe that there are women who would like to believe that we live in an oppressive patriarchy and men are out to get them, and it's 10 times harder to be a woman than to be a man, and the whole of society and culture is set up against you. There are Black people or other minorities who would like to believe we live in a white supremacist system and there's institutional and structural and systemic racism. It's so much easier to be a white man. It's so hard to be a Black man or a Black woman. Everything's against you, second-tier citizen, so on and so forth. There are people, regardless, different demographics have different narratives. And something I find quite remarkable about the modern West is no matter what demographic you fit into, there's actually an oppression narrative for you. And I think a reason a lot of people like the whole oppression Olympics and the I'm a victim thing is it gives them what I call a permanent alibi.
Yeah.
So I'm a Black man. If I were to go with this left-wing narrative of systemic racism and white supremacy and so on, anything that goes wrong in my life, anything that I personally fail at, any mistake I now have a permanent alibi. I'm no longer culpable. I can always fall back on, and I'm sure you've seen people do this, I can always fall back on it's just tough to be a Black man. It gets so hard. The system is out to get me. It's not me. It's the system. And so I think there are many, many different forms of that. And I think that the depression one is actually quite a universal one. So if I said that I have depression, I have this thing called depression or anxiety or mental health issues or whatever, I can no longer be fully held responsible and accountable for my decisions. If I treat someone badly, if I try something and I fail, if I'm just a jerk to people, if I'm being lazy, if I stop taking care of my health or I can always fall back on, if I don't want to go to work one day and I'm just like, I'm just going to give up. I can always fall back on, but I'm depressed. And people will sympathize. Right? People aren't going to be like you because it seems insensitive to be like, come on, bro, get up, go to the gym, go to work, do things, right? It's like, but no, he has depression, right? And so to me, this is like a very widespread version of that for many, many people. And I don't even think it's like intentional. I don't think people are sort of scheming and thinking about it this way. But I just think that it's very natural that one of the most core human traits, and we all do this, even people who are very disciplined and conscientious, we all like to put the blame on something outside of ourselves. Right? It's literally like pretty much the first story in the Bible. So let's think of let's think of an example that I'll use, right?
Sure.
I've got some meeting or something I'm supposed to be at. I'm supposed to be there at 2 p.m. And I'm just coming from my house. And I don't know, I get there 20 minutes late. No one says, you know what, I was a bit disorganized and I left too late. No one says that. You say,
blame the Uber or something.
There was a lot of traffic. There's Uber. We all know, had you actually planned really, really properly, you could have gotten there on time, but it's traffic, right? And everyone understands, right? There was traffic. But you probably knew there was going to be traffic, right? So we all do that. So I think there's always that desire to point outside, it's the economy. It's the political climate. It's this, it's that. Why ever you can't get ahead. Someone is obese. Not a lot of people are going to be like, I just eat too much and don't move enough. No one says that. Right? It's, the pharmaceutical companies and the food companies and the advertising companies and the time and this and this. And we all empathize with that because it's not totally false. There's a lot of truth there. But it's like, ultimately it's still on you. You're a grown man, you're a grown woman, you're the one still controlling what's going in your mouth. And sure, there are outside influences and there's all sorts of things in our society and our culture that do make it more difficult to stay in shape or do make it more difficult to maintain a healthy body weight or do make it more difficult to just be psychologically happy, let's say.
Mm-hmm.
But ultimately, in my worldview, it ultimately falls down on the individual. And are there things that should be changed in the system, to use that term, to make it easier for people to flourish? Yeah, and I'm all for that. But it's a lot easier to change an individual's behavior than it is to change the whole system or the whole nation. I mean, we're talking about multiple nations in some of these conversations. So that's kind of my thinking. But I think that's why people are very sensitive and kind of cling on to this, because they don't want to let go of that permanent and convenient alibi. And as you've already said, in certain social circles and demographics, you get social clout for it. You get points, you get virtue points for it if you are just happy and healthy and normal and you don't buy into any of these narratives, right? Like I've got videos with 1 million views on YouTube of me being like, yeah, white privilege isn't real. Yeah. People are like, what? Yeah. What? Do you hate yourself as a black man? I'm like, all right. So I don't think white people are advantaged over me. So that means I hate myself. Like, you should be happy to hear. Yeah. You see what I mean? Yeah. Like, why do you want me to believe that narrative? You want me to believe that everywhere I go, whether in the UK, the US, like everywhere I go, white people have some type of privilege or advantage over me just sort of inherently in the system. Like, I don't believe that. I've never believed that. And I don't think a few decades ago that would have been super controversial, but now it's like, no, you must buy into this narrative. And if you don't, you're a heretic. Yeah. And so you asked like a moment ago, why isn't this so obvious? Like when we're talking about this like this drugging of like life problems away and like why that's wrong. It's, it's when you have like you said, I mean, there is this whole oppression Olympics thing going on. It definitely is a left-leaning narrative where like that discourse is just shut down. And the thing that makes it really bad in psychiatry is that the pharmaceutical industry is involved and there's like a clear commercial interest. And so when I'm out there or when Mark Horowitz is out there or any of the other prominent psychiatry critics, we are stigmatizing people. We are dangerous. Yeah, and we're scaring people away from life-saving medications. People are going to commit suicide because of us. And so, I mean, that's why people aren't waking up, because I'm getting throttled on YouTube, when I talk about these topics. And that's because it's like mainstream media won't talk about it. They're just saying, like, anyone that criticizes this narrative and says, actually, hey guys, you have agency, you can fix your life. Like, things are actually going to work out a lot better for you if you wrestle you wrestle your life back from the family medicine doctor who sees you for 15 minutes every 3 months. And if you actually go, I'm going to take care of this myself. You're a prick. Yeah. You're insensitive. Hate speech. Yeah. And so people don't realize we're battling against almost like a political party, but also just like a juggernaut of marketing that is just coming from the drug companies that is just really just pushing this narrative that's holding people back. And it's like there's like a horrific there's a sinister part of this because it gets people essentially just trapped on drugs that they take for the rest of their lives, believing they have no control to fix things. Yeah. It's fascinating. When I look at the last decade in particular across the West, I certainly notice, I often pay attention to like who gets attacked. Yeah. Who sort of gets attacked by the machine and by the mainstream media. Oh, man. And sort of what's the through line. And something I've picked up on, regardless of the individual, it's people who really push for accountability and personal responsibility in any field. That is like the message that gets demonized. That's like, no, we need to shut that down, right? It's not people who are saying things that are like, genuinely hateful, or they're calling for violence, or any of those type of things. It's like people who are. I mean, if you want to see them, go back a few years ago. Look at how like the mainstream media, treated even like a Jordan Peterson. Yeah, what's his core message? Stand up straight with your shoulders back. Clean your room. Clean your room. Take personal responsibility. Carry a load. Right, like it's a message of responsibility. Yeah. And you see the level of attack and demonization, and you're trying to make this guy out that he's a Nazi, he's an everything phobe, he's in all the isms, all this. And it's like, his core message is like what your granddad
Yeah.
would, or your responsible dad would have essentially told you. He's just doing it on YouTube and on podcasts. You look at the way they try to, take out a Joe Rogan.
Yeah.
People who are like, personal responsibility, accountability, and also just free exchange of ideas.
Yeah, they just killed Charlie Kirk because of it.
Exactly.
Literally 3 days ago.
Yeah. And the core message comes down to responsibility, accountability, patriotism, not just, woe is me, I'm a victim, I can't do anything, we need to overturn every single.
I used to be liberal. That is kind of how I grew up. And yeah.
My condolences.
Yeah.
No. I have many liberal friends that I love, but I've never been one.
I radicalized is what I was going to say when I came to the US. So I arrived here in 2015. This is like the year before.
Where from?
From Sydney, Sydney, Australia. Liberal parents, lovely people.
Sure.
And this was the year before Trump became president. So I got to be here through the Republican, the Democratic primaries, and got to see all of that. And this was right when like the woke stuff really hit like fever pitch.
2015.
Yeah, nothing could radicalize me more. Like I remember feeling disgusted with the Democratic Party because all of a sudden it was, you mentioned it before, oppression Olympics. It's like we're going, white men are bad, all of the DEI stuff. And I was just like, this is insanity. And so, I love Jordan Peterson. And when he came in and all of a sudden I'm like, this party isn't mine. Even though I would say I'm center right now, I actually still have a lot of more lefty ideas, but no way. There's something just gross and disgusting about building a party around victimhood and pandering to a base about saying, hey guys, you're victims and you're oppressed and we are so sorry for what's happened to you. And it's just like blaming others. That was just disgusting to me. I mean, that was the thing that kind of like pushed me over.
That's
I was just like, I guess I'm, conservative. And people think I'm, I think, and the other interesting thing is like, as soon as you kind of veer from that like super woke message, like immediately your friends think you're like far right, is how it's kind of how you get characterized. Like there's no like middle ground. As soon as you kind of like veer from that, like you're, super ultra mega MAGA,
It's very interesting the politicization of things that really shouldn't be political as well. Like you're looking at, until 5 minutes ago, RFK Jr. was a Democrat for his entire life, right? He's a Kennedy. And his whole thing, make America healthy again. Maha, like he's like, all right, cool. Like compared to all the countries in the world, we have a ridiculous amount of processed foods and weird artificial dyes. And there's all these things that are banned in Europe and banned in Australia, which we allow in our foods. And the pharmaceutical industries, big pharma's out of control and so on. And you just see some people's response to that. Like this shouldn't even be a political thing, right? They shouldn't be left and right in terms of like health, in terms of nutrition, in terms of exercise. I'm sure you've seen these articles in The Guardian and other places about how, fitness and strength training, makes people far right, is associated. The dangerous connection between bodybuilding and the far right. Or, you're just like, what is going on here?
Yeah.
Like, shouldn't everyone be on board with Make America Healthy again? Maybe you don't like the slogan, but like the concept of it. You have huge levels of obesity and diabetes and metabolic health issues and, childhood obesities flying. Decades ago, none of these things were big problems. And they are now. Why has everyone suddenly got autoimmune conditions and all these kids have peanut allergies, which didn't used to exist, and all of these things. And you have a guy who's like, all right, I want to get to the bottom of this. I want to look at some of these industries and some of these lobbies, and we want to get, and you have people who are like, no, like we're now against you because of this political brain rot, which is like forcing everyone to see things as everything's left or right. Like it's this weird binary.
People don't see it and they're so stupid. Like I look at it, I'm just like, this is ridiculous. that, I mean, I don't know. Did you see the exchange between Elizabeth Warren and Bobby like the other day?
I actually haven't. No.
Yeah. So they're talking about vaccines, and she was like, "Well, you promised you wouldn't take the vaccines away from people." He's talking about the COVID vaccines and how they changed the coverage for it, and he was just like, "We did the research and we found that they weren't effective," and she just freaked out about it. And it's like, and he was like, "Do you want me to give these drugs out to people that our own scientists say don't work?" And she's like, "But you promised to not take them away, you know?" And it's people don't care about like actual rationality anymore or the science. Like it has totally become political. It's like the fact that he wants to look at the, you know, we're going to get throttled now. The fact that he wants to look at the vaccines. I'm sorry for your YouTube channel. Yeah. The fact that he wants to look at the vaccines and the, and the fact that there's no placebo controls, and they want to have another look at that. Why is that so controversial? You know, why don't we want to have good quality evidence about these things? But, you know, people are just radicalized, and then they're just like, anything that he does is bad because I watch CNN and New York Times and they say he's bad, and so he's bad. Yeah.
It's very weird.
Yeah.
What do you think are the situations where antidepressant or antipsychiatric drugs are useful, or when would it be valid and helpful to prescribe those?
So originally, like when I went into psychiatry, I was thinking like, hey, we're mostly going to be helping people with like relationships, work, health, and in some sparing situations, we would use the drugs when we can't get people better with that. And then I go into my training, and I don't see that at all. We were just pretty much nuking everyone with the drugs after a really short period of time. And so my criteria is that you should only get on one of these medications if someone's looked at your relationships and they've helped you there. They've looked at like purpose and work for you. You've got your metabolic health dialed in. You're moving your body. You're getting enough sunlight. You're not abusing drugs and alcohol. Like those are the big four. Like if people worked on these four things, like 95% of people wouldn't need to be on psychiatric drugs. So if you do all of those things and you're still feeling really unwell, maybe there is something that we haven't found yet that is affecting you. I don't think you should not take medications then. I think you should use the science that we have. You should use the drugs. You should be aware of the side effects and the risks. And so I'm very much in the camp of like, you use them when all other non-drug approaches have been trialed. But that sounds like so logical. And I imagine you could hear that and be like, isn't that happening?
I've said that for decades.
Right now? It's not.
Yeah.
It doesn't happen at all. Yeah.
I think part of it as well is that one of my biggest criticisms of the way the modern Western world deals with health is how siloed it all is. It's not holistic. So physical health, I mean, you can even break that down into like very, very specific parts of the body, but physical health, mental health, spiritual health, another controversial term. They're entirely separated. They're entirely different fields with different professionals. They don't talk to each other. People don't even draw the connection between them. I mean, as someone who's been going to the gym for like 25 years, I've even, you know, on my social media or whatever, like I've put out things essentially alluding to the fact that like, if you get if you exercise regularly, if you lift weights, if you eat decent food,
how dare you?
It's going to be like very effective for your mental well-being.
Yeah.
And I remember, you know, during early 2020, one of my massive criticisms about the lockdowns beyond the, you know, civil rights violations and the loss of liberty was, you know, telling people not to go outside, telling people not to go to the gym, you know, shut down the, close down the gyms, don't go outside. I was like, wait, if this is a health thing, then this is all obviously backwards to me. Don't go outside, don't get sunlight. It all seems really backwards to me. And it's this compartmentalization where like there are people who think it's weird that if I say, oh, if someone's depressed and I'm like, yeah, you know, they should go to the gym and lift some weights. There are people who think like I'm being glib or that I'm just like there's no, as if, what are you even talking about? Like there's no connection there whatsoever. And I'm like, if you can't even see the connection between exercise and mood and mental well-being, like you're already so lost. Like even just on a very micro scale, we all know, even on a day-to-day basis, especially if you've been inside all days and just artificial light and you've just been sitting at a desk or whatever, and you're just going for a 20-minute walk outside.
Yeah.
Like it feels good. It improves your mood. You think a bit more creatively. If you've got like a writer's block or something and you go for a little walk, it can help. Everyone knows, I mean, you go for a run, you lift some weights, you do any kind of exercise, play football, tennis, whatever. You get that endorphin rush, you feel good. And it's like, this is totally disconnected in so many people's brains from the mental part, right? So people say, oh, we need to talk more about mental health. We need to talk more about mental health. And I'm like, well, not in isolation.
Yeah.
If you talk about it in isolation, you're missing a huge percentage of the picture, because as human beings, you know, we're literally interconnected. My brain's not outside my body. It's all connected.
There's this thing called like the neck that connects your brain. You know,
it's very literally connected
to the rest of the body.
Yeah.
Yeah, I mean, mental health. I mean, it's physical health, right?
Yes.
I mean, if you poison your body with, you're just eating like so many refined carbohydrates that you become insulin resistant, like your brain is not getting energy. I mean, it's harder to bring glucose into the brain cells. You are going to feel terrible, and you like moving and exercising has all of these amazing anti-inflammatory properties as well. And so if you're just eating like shit processed food and you like never move your body, you're going to be inflamed and you're going to have like brain fog as well. So, usually the people that like throw that hate on you when you say those things, they are like not exercising, they're not eating clean, they're not really working on their life.
I generally don't find that I tend to get hate for that.
Yeah.
But more like confusion.
Yeah.
Like people haven't even thought of, maybe the way I'm feeling mentally and my mood is connected to my physical condition and my physical behaviors. Like it hasn't even, you see what I mean? Like they think of them as completely separate categories in the way that, I don't know, like no subject is totally disconnected, but the way physics and history are disconnected, right? So it's not holistic. And then the concept of like spiritual health as well. And you could even talk, you could obviously talk about relational health. You could go granular and talk about, financial health, all of these things, but they all have an impact. Yeah. They all have an impact. They're all stressors. They're all stressors. And generally our mood is, I like to think my mood is telling me something. If I'm feeling angry, there's a reason. If I'm feeling sad, there's a reason. If I'm feeling sad consistently, that's a clear sign. Okay, there's something in my life that I need to sort out. Now, this could be temporary. It could be very obvious. A loved one passes away.
Yeah.
Right? Like you probably should feel, quote unquote, depressed.
And this is why
but
that idea of like the chemical imbalance is so pervasive and dangerous, right? Because you might feel like kind of foggy and restless and not good. And if someone has just told you your brain is malfunctioning, you're not going to think like, well, maybe it has to do with the fact that I had like 3 cups of coffee and I'm chewing tobacco and I've just like sat in this room. 2 hours of sleep. I'm just sitting in my room behind my computer. I haven't gotten up. I don't like move my body at all. It's just my chemical imbalance. I need, give me another 5 of Lexapro. Thanks. Yeah.
What are SSRIs?
So they are selective serotonin reuptake inhibitors. They essentially go into the brain and they block the reuptake of serotonin from the space between the neurons. And so that's kind of like the point where the drugs work. So the neurons communicate to each other through like chemical messengers, it's like serotonin. And so if you use an SSRI, it's going to block the reuptake and it like increases the amount of serotonin between the neurons. And that's what gives it the drug effect.
Okay.
Yeah.
And how widely used are those?
They're the most common class of antidepressants. I'd say probably like 10% of the US population is probably taking an SSRI.
Okay.
Yeah.
And what are the risks there? Because I often hear, when horrible, tragic, crazy incidents happen in the USA, whether it's mass shootings or that type of thing.
Okay, let's go.
So often
Yeah.
it's found out that the person
Yeah.
was on SSRIs.
Yeah.
I don't really know what that means. I don't know the mechanisms. I don't know if it's, well, I don't know the correlation versus causation there.
Sure.
Obviously, for someone to do something that heinous, there's something mentally that's up with them. So sure, there might be a correlation that they're on some type of drug. But I also am aware, even from watching TV in the USA and seeing your insane pharmaceutical ads, when they're given all the potential side effects of things that can happen, often, things like
homicidal ideation, suicide.
Yeah, exactly. I'm a bit like, wait, what is going on here?
Yeah.
So ball's in your court. Can you explain this?
Yeah, sure. Okay. So, so this is another one of these things that people think is really controversial, and it shouldn't be. When we're talking about violence on psychiatric medications, we are talking about paradoxical reactions. And so these are rare side effects. And the way I like to explain it is, there are some like quirks about people's brains that make them have unpredictable reactions to drugs. Like you could have like 10 people sitting around smoking joints, 9 people are laughing, they're giggling, they're having a great time. One person's becoming paranoid and they hate it.
Mm-hmm.
And so the same thing happens with SSRIs.
Mm-hmm.
So generally, the effect of this drug is one of mood constriction or numbing, as some people will say, and that can be experienced as really therapeutic for some people, even life-saving. But sometimes people will have paradoxical reactions on these medications, and it will make them aggressive, it will make them hostile, and it can even make them more suicidal. And so if we focus on like the mass shootings, let's kind of talk about that relationship. People are usually surprised to hear this. If you just look at the drug labels in the USA, like they are filled with warnings about violent behavior. Like for Adderall and Ritalin, there's a whole section in the warnings and precautions about like aggression and hostility. Like if you look at the SSRIs, it clearly says it can make some people more irritable, hostile, and suicidal.
Mm-hmm.
If you look at antipsychotics like Abilify, it like lists homicidal ideation as an adverse reaction there. And so that means that all of these things have been seen before.
Mm-hmm.
And so the next question people say, well, maybe, these are side effects, but can they actually lead to mass acts of violence? And most people are surprised when I tell them that, yes, it's happened before. And so there was, and it's happened numerous times, and it has gone into the court system. There was a really notorious case from the 90s about a gentleman called Don Shell. And he was a guy in Wyoming, and he had been exposed to fluoxetine, which is Prozac, before, and he became agitated on it, and his doctor took him off it. I think he went and saw another doctor a few years later, and they put him on Paxil. This is just like fluoxetine. It's an SSRI, same drug class. And within a week, and so he never should have been put on it before, again, because he had already had that bad reaction. But he gets put on it, and within a week, he kills his wife, he kills his daughter, and he shoots his granddaughter dead as well. And then he kills himself.
Wow.
And so the surviving son-in-law ends up suing SmithKline, which went on to become GSK, over failure to warn. And this goes through a jury trial, and they find the drug manufacturer liable for failure to warn. And so that is a mass shooting and a suicide right there, where the jury has found that if not for the drug, like Don Shell wouldn't have killed his entire family and then himself. And so they appealed it, and the verdict stood. There was also another case called the Josef Witt-Doerring case, and I think this was in Louisville, Kentucky, and he went into, I think it was a paper mill with a gun shortly after, very similar circumstances, had a bad reaction to an SSRI, was re-exposed when he shouldn't have been, and he carried out a mass shooting there, and he killed several people. There's some interesting history here. This was like a bellwether case, because there were many other cases kind of coming together to say that these drugs could have these rare homicidal, could kind of push people into homicide. And it was actually secretly settled out of court, and they tried to hide it because it was the first case, and that was going to kind of hang a shadow over all the ones that were coming afterwards. The Eli Lilly ended up kind of settling it behind the scenes and then pretending that they didn't do it. And so, I mean, you can read into the culpability there that went to a settlement. And I mean, this has happened again and again and again in many different courts. But, the issue in the US is we don't look at this right now. Like whenever there is a mass shooting and the person is on psychiatric meds or they're on all these these hormones, that's been another big thing lately. People have been worried about all of the transgender violence going on. We don't look at it at all. And I'm not going to sit here and tell you that all of the mass shootings are because of psychiatric medications. I mean, there's clearly social contagion going on.
Some people are evil. Evil is real.
And people just evil.
Evil is real.
Yeah. We also have a lot of guns in this country. Yeah. And that's the reason why if someone becomes manic or psychotic on this drug, it's pretty easy to grab a gun, And so it's a complicated issue, but you have to look at the role these are playing because it actually leads to real changes that can help people. So what would those real changes be? When you get put on a psychiatric medication, it would be a great thing if you had a family member there with you. So you could say, hey, we're putting Zuby on a medication right now. In really rare instances, it might actually make him worse. If you think he's uncharacteristically, becoming more depressed, or maybe he's even looking kind of agitated, can you call me straight away? Because I'd want to see him and I'd want to stop. I don't want to stop that. Doctors would actually start doing proper informed consent about this. They don't talk about these risks with patients frequently.
They don't legally have to. I'm assuming.
Informed consent in the US is just like it's just essentially fake. Like you can, the doctors can just claim that they've done it before. You don't have to sign anything. Like the experience of getting an SSRI is typically this. You go and you see the doctor. They go, you have depression. Here's the Zoloft. Hey doc, what side effects do I need to worry about? Well, you could get some nausea. You could get, a bit of an upset tummy. Sometimes people feel a little bit irritable, like in the first couple of days, but otherwise they're safe. Hey, if anything happens, just give me a call. You then go and to the CVS or the Walgreens, which is our big box retailers for the meds. They slide a keypad towards you. People usually don't realize what they're signing on that keypad, but it says you've been given a chance to talk to the pharmacist about the side effects of the medications. Most people think it's just like a credit card thing, and then they give you the drug. And so no one's really going through like all of the side effects. And I'd love to talk with you in depth about some of the other ones outside of this. No one's really going through the side effects with you. And if anything ever happens, the doctor says, yeah, discuss the side effects with them. And no one can really prove it.
Because you signed.
Well, because
you did side saying you had the chance to.
Yeah, you had the chance to talk to the pharmacist, and then they just take the doctor's word for it. But listen, these are 15-minute visits. It could take me 15 minutes just to go over the side effects of a medication to give someone proper informed consent. And so there is coming back to the mass shootings, there is a change in the US now where, Bill Lee from the state of Tennessee thankfully passed with bipartisan support at the state level that they're going to investigate the role of psychotropic drugs in mass shootings now. Because most people, they want to sweep this under the rug. Because if you could imagine that you're the surviving family member of someone that just killed a bunch of people in your town, you are not going to say, hey, maybe it was the drug. The backlash that you would get from that, they might think hey, you're trying to make an excuse for what's happened. And so I also think there is a tremendous amount of pressure that when these things happen, people don't want to ask questions. They want to move on from it as quickly as possible. But the government actually needs to look into that and hold the line and say, no, we have to ask these questions. Yeah.
I don't know if you know the answer to this question, but do you know my brain is puzzled as to what the mechanism could be that, there is a tablet that someone could take that makes them start ruminating on homicide or suicide? Like,
Yeah.
what's the mechanism that even causes that? Like, it seems very left field. It seems very strange that, I don't know, you could give someone a pill and suddenly they start thinking on those things, because I don't get it.
So it can happen in a few different ways,
Okay.
and maybe I'll start with like the more extreme ones, and
Okay.
I'll kind of go down to more subtle. And so at the extreme end, you could just become really paranoid. And so there was a case of a guy called David Carmichael, and he,
That rings a bell.
yeah, he's a Canadian. He's a Canadian guy. Never had any history of violence. Really loving guy. He got put on, I think it was also Paxil. Paxil's a nasty drug. That's a really bad SSRI. He became psychotic, and he started to believe his son, who had a seizure disorder, was going to die and was like going to have all of these problems. And so he actually killed his son by accident when he was in a drug-induced psychosis. So at the far level, you can start to develop these psychotic ideas. My son is going to die. It's going to be really terrible. It's more compassionate for me to put him out of his misery.
Is that just like a chemical change that happens in the brain and it's just not firing correctly?
Yeah, full on psychosis. Think delirium. Like you're just not even like in the right mind. And that factored into his trial.
Mm-hmm.
I mean, he didn't go to prison. Like I think he was in a psych hospital for a couple of years afterwards, but he ended up being released because everyone looked at it and there was like, there's no way this guy did this on purpose. And if you just look at the time course from when he got on the medications, like you can see that.
Yeah.
And so full on mania and psychosis, and that can happen. Like you can trigger like manic episodes and all of that. Other things that can happen on these medications is something called, and I'm kind of veering into suicide a little bit here now as well.
It's leading cause of death amongst men in my country.
Yeah, yeah. There's something called akathisia, and this is a state where if you take a medication, you can become incredibly anxious and restless, and people will start to pace around the place. They start to say things like, I want to tear my skin off. I want to like get out of my body. They're so uncomfortable. And people will jump in front of trains because of this. This happened to someone called Stuart Dolan a few years ago in a state of akathisia. He threw himself in front of a train. He was never suicidal to that level before.
Wow.
And some people will even impulsively commit acts of violence towards someone. Imagine being in such an agitated, uncomfortable state, and then someone says something to you that rubs you the wrong way. You can react in a way that's completely out of context. Now, the last mechanism I think of when I think of drug-induced violence and suicide is emotional blunting. And that's kind of like the effect of the medication. Some people are inhibited from doing terrible things like suicide or violence because of the ramifications of that. They think about their families. They think about the impact it would leave on their children or their loved ones. And that fear, if you start to blunt that, if you put someone on like a heavily blunting drug, they don't care about that anymore. And so it can also lower inhibitions and can make people do it. And so that's the way I see violence and suicide happening with these drugs.
Got it. That's really interesting.
Yeah.
Yeah, no, that's really useful. There was something you said that you wanted to talk about some of the side effects. Yeah.
Yeah. So I strongly believe that a lot of people would not take SSRI type medications if they actually knew the risks. And so one of the risks, which has been made really well known by the PSSD network, they actually put me in touch with you. Shout out to Daniel for doing that. It's a problem called post-SSRI sexual dysfunction. And so most people who get put on SSRIs develop sexual dysfunction. It's like 70%. And so this is, muted orgasms, erectile dysfunction, just overall lower libido and lack of interest in sex. It's kind of that constellation.
It makes sense if it does everything.
Yeah. But we tell people that it's going to go away when they come off the medication. Many people will accept that as a trade-off. Hey, I'm really suffering at the moment. I'm going to take the hit, and I just know that it's going to come back later on. But for some people, it doesn't. And that is obviously horrifying. And I mean, if you were like, would you take a drug if you were like a kid, a young man, and they said, hey, Zuby, there is a chance that you could develop permanent sexual dysfunction that does not go away afterwards? Like 99% of people would say, fuck no. Yeah.
Unless it was like literally a life-saving thing. Unless it's like a life or death decision.
Yeah,
no.
Exactly. Now, I tell this to people and they go, this is crazy. You're like a nutter. Like there's no way this is a side effect because, we have, 15%, of our country on antidepressant medications. And then I tell them, this is in the warning and precaution of like every single SSRI and SNRI in the European Union. That's the second biggest drug regulator in the world. It's in the labels in Australia. It's in the labels in Canada. It's in the labels in Hong Kong. And currently right now it's being considered to go in the labels in the US. And this condition can be so bad. Like not only do they get sexual dysfunction, many people will end up with severe emotional blunting. And they describe it like this. It's like when I go and hug my kid or like my parents, like I feel nothing.
Wow.
When I listen to like my favorite song from childhood and I expect to have this like prickle and, this kind of like prickle on the back of my neck, this kind of rush, I don't feel it. They feel dead inside. And they also have like cognitive impairment. And you've essentially given this person a brain injury and a brain injury that for many of them is permanent. And so I think this is one of the biggest scandals in psychiatry right now, how we're giving people these medications and not warning them about this uncommon but very serious side effect.
It's like a chemical lobotomy.
Yeah. And you wouldn't believe, like I talked to two guys on my podcast who after this happened to them, these are heterosexual guys, they started to question their sexuality as well.
Really?
Like it really messed them up. I mean, that's a whole nother tangent if you want to talk about like the role of these drugs and sexuality, but that's...
Wow. I mean, it's fascinating. I mean, I want to expand the conversation a bit and kind of go up a level. I mean, we've touched on this a little bit here and there, but what do you think is going on in modern society, particularly modern US society, that is causing these spikes in real or perceived depression, anxiety, suicidal ideation? I mean, the numbers they're just going up. They're just going up and up and up, particularly amongst young people, young women in particular, in fact, seem to be having the highest rise in all these things. I know it coincides with smartphones for sure, so that's a factor. But just what's happening in this wonderful and prosperous and privileged country on so many levels that so many millions of Americans are even getting to the stage of feeling like, oh, I think I need to take some sort of drug. Because we can even expand this conversation. Like if we go beyond psychiatric medication, I mean, what if we add the amount of people who are using alcohol or other drugs?
Why are people so unhappy?
Just to numb their feeling. I mean, if you were to include those, you'd probably be at least half the population or approaching it. So what's going on? What's underneath that?
I think I come back to my framework where it's like it's relationships, it's meaning, and then it's also health. And so let's talk about we've got a breakdown in religious communities and congregations. I think we have a lot of social isolation going on now, especially with the internet. I think people are more disconnected than ever. It's so much easier to sit at home and just like flick on Netflix than it is to, I don't know, like sit on your stoop in Brooklyn and, like kind of like you're with your neighbors in your community. It's like, it's so comfortable to not have those social interactions anymore. And so I think that is a big piece of what's going on. I mean, I see it in my own life. I mean, I've moved like 6 times in the last 7 years, like for work and trying to get set up in different places. And it's taken a toll on my wife, for sure. It's taken a toll on me as well. We used to be grounded in these communities and we'd have our parents around and our friends and we'd be having our kids, and like our friends would be having kids, and we'd be all together. We wouldn't be like patching things together.
Yeah.
And so we're also like a really mobile community now that really like puts a massive emphasis on work. I have to mention economic problems and inflation in the US. It's like a lot of people are raising kids with both parents working, and they're hardly making ends meet. And so it's, people are in debt. They're having a hard time affording homes. Like, you can't spend as much time with your kids and be like fully present. Like that is objectively harder than it used to be. I mean, there's big pressure there. And I do think meaningful work is important, but I actually don't think it's as important as those other ones, like, relationship and that kind of security. Because I know a lot of people with jobs that they don't like, but they're just lovely, happy people. They're just like, this is just kind of like, I just do this to make money, and I'm with my family. And you can live a really meaningful life. That's just kind of like your trade-off.
Yeah.
But the other thing that really messes people up, it's their physical health.
Oh, for sure.
It's the fact that 60 to 70% of our calories come from processed foods. We are biologically unhealthy. Like our mitochondria are shot to pieces. And if you just feel shitty all the time, it's hard to want to do things. And then you stack that on top of a lot of what we've been talking about is these really disempowering messages that we get from the media, that you're a victim. It's because of some other group in society, and you need to fight against them, rather than like, hey, you're powerful and you can do this and you can pull yourself out of it. I bundle all those, but I'd love to hear what your thoughts are. I mean, you're a very observant guy, like
you've touched on the vast majority of them.
Yeah.
And, on top of this, I think there's a layer of talking about root problems is uncomfortable and it's not politically correct. So the problems exist, but then people also shy away from diagnosing the problems properly because as soon as you start to talk about God and faith and religion, people get weird. As soon as you start to talk about the rate of broken families and people are growing up with, divorce being so common and single mother households, highest rate in the world. So many kids growing up in fractured families. As soon as you start to talk about obesity and health and people being too fat and not exercising enough, like, all these are very like, tread very carefully topics. So people just dodge it. And I always say that if you can't talk about a problem, then you certainly aren't going to find a solution.
Yeah.
And so, I think people need to be more courageous and bold and just be willing to put the cards on the table and have all of these conversations. I mean, all the things you said, it's like fundamentally, we've moved so far away from the way that human beings have always lived.
Yeah.
And there are benefits to that. There's so much surplus. There's so much comfort. Day to day, like in terms of basic survival has never been easier than it is now.
Yeah.
Something interesting with obesity is you'll find that people blame obesity on both poverty and affluence. Right?
Yeah.
And they both kind of make sense in a way. But it's not just lack. It's like we just have so much. Life is so easy. How many steps are people even taking every day? Do most people even walk up to 1 mile a day, especially in the US, just driving everywhere? Everything's drive through, all the food. Like even coming from the UK to the US, like my mind is always blown by just like the sheer amount of fast food and garbage food just everywhere, and nobody walks anywhere.
Yeah.
And, it's the city, even the way the cities are designed. So I think like a lot of progress is, how would I put it? We're victims of our own progress in many ways, but everything is just so artificial and fake, and people are so removed from the things that keep people grounded and joyful and sane. And then you add in new technologies that accelerate the disconnection. They don't connect people more. They separate and disconnect people even more. So you just have these, as you've said, layers upon layers of stuff. The thing is, if to be a healthy individual in the USA, you can't do the norm.
No.
If you do what is considered normal, you do what majority of people are doing, you will end up overweight. You will end up in debt.
Yeah.
You will end up like you have to go against the grain. So if you just go back, I don't know, maybe 70, 80, however many years ago, if you did what most people did, you'd be all right. Now, if you do what most people do, you won't. So there's been economic progress, and I'm sure, GDP is higher than ever or whatever. But if you actually look at health, you look at life, you look at family, you look at faith, you look at community, you look at how people are actually like feeling and how connected they are and how healthy they are, it's actually severely declined. Yeah. So there's been progress in one sense, and there's been massive regress in other areas. You don't even need to go back that far. You could go back to the 90s. You could go back to the 80s. You could go back to the 70s. And you can see by certain measures, oh yeah, things are much better. Yeah. And then by certain other measures, you're like, whoa, we're way worse off than we were 50 years ago.
Yeah, because I mean, we go, oh, America, #1, GDP, look at how good we're doing. But like if I think there's like some metric out there, like some kind of like happiness metric, or I mean, just use the rate of suicides. I mean, we're not doing great if you look at like the incidence of suicide in the US compared to some of these Slavic countries that that seem to do a lot better. So
you mean Scandinavian?
Scandinavian, yeah, that have much higher quality of life over there. It's very interesting as an Australian. Like I always grew up with people kind of complaining about like America. Like it's like a nice pastime. We're just like we sort of complain about like America and the capitalism, and then when you get here, people are just like, oh my god, those like lefty Brits and all those socialists over there in Europe. But I mean, I was just over there, and I was in Helsinki, and you got to give the devil its due. Like when you look at the way they structure these cities over there. Oh man, the public amenities are incredible. I spent some time in Hungary at like the baths there, and you can take your kid.
They're cool, aren't they?
Yeah, they're amazing. It's like a really cheap like water park where you can hang out all day. It's super fun. Everything's walkable. Like the public parks are amazing. It's just a city that's just like built to be
human friendly
and human friendly. And I lived in Houston for 4 years, and that place was a shithole. Like, like it's just like concrete.
I've been to all these cities, so I know exactly what you're talking about.
Yeah, you got to drive, and I remember sitting there in the middle of the summer, just being like, I can't even go outside. Like there wasn't even like a great like if they had like a Hungarian bath in Houston or something like that, like it would bring people together. And so you're totally right. I mean. We don't emphasize like livability in the US. We emphasize profitability, and that's like you probably spent some time on Instagram. You've probably seen the rise of like the homestead like influencer, like Ballerina Farms is like a really big one. She lives like right down the road from me in Utah. But I'm actually heading in that direction myself. Like when I like kind of lie down in bed and I'm talking to my wife at the end of the day, the things that I'm thinking about, I'm like, I don't want to have a virtual practice exclusively. I want something in person. I want something on 50 acres. I want us to be able to grow some food. I want us to be able to be there with my staff. Like, I love my staff, but we're a virtual team, and everyone's like, remote work is like the greatest thing ever. So overrated. Like, I love being now that I'm living it. I have to like go back. I want to be in person. I want my family to be there. I want them to be around my staff. I want to feel like I'm on a mission with like all of these people, and we're helping people fix their mental health and come off medications. And we're just like, going for a walk in the middle of the day together. Like I'm going back in time, and that's, and because I'm struggling. Like I've been living it like these American problems, and I love this country. I love the opportunity. I think it's awesome for some things, but it's not great in other ways.
Now that we're going into philosophical territory, which is interesting. These are the type of conversations I love. I just think like so many individuals and people, maybe even like nations, it's almost like we should question the scoreboards that people are using.
Yeah.
Right? So on a national level, when you think of like wealth, or you think of where's rich, or you think of where's good, like it's purely economic in so many cases, right? It's just GDP per capita, and by the way, GDP can be fudged in all sorts of ways. People don't think of like, the things that are just more fundamental to humanity. And those things haven't changed. That's what's so fascinating. For the millennia that human beings have existed, it strikes me that things that have always been important to people, that in terms of like true long-term happiness, life satisfaction, meaning, purpose, it's always really been faith, family, community, sense of meaningful work, and physical health, let's say. Like those, you could add additional pillars, but take those pillars. And if those things and if those things are in place, regardless of income level, sure, it's easier if you have more money, but in terms of a life satisfaction and happiness, I don't think it's incredibly important. Certainly not past like
you don't need
basic level.
You look at people in like India and they're so like they have
all over the
less,
world.
And on average they're happier than Americans. Like you look at people in like Africa as well, like they are happier than Americans with far less.
Yeah,
because those things are in place because they still have their communities intact.
Yeah, exactly. And it seems like those things have just been lost. Not entirely, because like I said, human beings, we haven't fundamentally changed. Like we're not any biologically different from our grandparents or great grandparents or great 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 grandparents. We're just living in a different world with different technology, and everything's easier. Things that weren't possible before are now possible, and I'm very grateful for a lot of it. Like what we are doing right now, and the fact that we'll be able to beam this conversation out to thousands of people all over the globe, and they can just listen to it whenever they want. That's incredible. But still, after this, it's important for me to go outside and go for a walk and do some exercise, right? And not just be in the artificial light and not moving my body. And you just have to be very conscious now. I think that's part of the problem, because something I notice particularly, I travel all over the world. Something I notice more in the USA than any other country is to stay healthy, you have to be very conscious and conscientious.
Yeah.
If you come to the US, you'll hear people from all over, like you hear it both ways. Americans will go to Europe and they'll be like, hey, I just was living and I lost 10 pounds, right? Like I was just walking around. Yeah. I didn't try to and I lost 10 pounds. But then the other way, a European will, a German or a Brit will come to the US and they'll be like, man, I was there for 2 weeks and I gained 10 pounds.
Yeah.
Right? And so you just have to be very conscious. You have to think like every meal you make or order, when you go to the supermarket, you have to be more careful than you have to be in Australia or in the UK or in Germany. If you go out to a restaurant, you have to be more careful. The portions are going to be way bigger. There's going to be way more oils, way more salt, way more sugar in everything. You just have to be more conscious. In many cities, if I'm in the UK or pretty much anywhere in Europe, I'll hit 5 miles plus walking a day, 10,000 plus steps a day by accident.
Yep. Yeah.
If I'm in Houston, Dallas, Las Vegas, where like I have to consciously be like, I have to be on the Fitbit, like, okay, I've only done like 1,700 steps today. I need to just go for a walk, because you don't have to. Like, and it can be much more difficult because you walk outside. It's like there's nowhere to even walk to.
There's no footpath.
There's nowhere to walk to. So I just think I think that's the thing. People have to just be very conscious. And I get, look, people are busy. People have all these other priorities. Everyone's scrambling. We don't need to go deep into the whole broken money system, but that's a massive, massive problem that I've talked a lot on my podcast and other things, where everyone's just scrambling all the time because the money's fundamentally broken. So it's always losing its purchasing power. And it affects everything. It's affecting couples forming. It's affecting marriages. It's affecting birth rates. It affects everything.
When you have that financial pressure, that can delay starting a family. And I mean, the other thing with the US is just health insurance, man. You're just on a treadmill for that. Like, it is so hard to say, oh, I'm going to take a break from this job. I'm just going to like live off my savings, because like, hey, where's that? Like, $1,500 every month, for your family's health insurance going to come from? Like, so you're worried about that. You're worried about like the debt. It's like, once you get started here, like you can't stop.
Yes,
like
that's a good point.
They just like lock you in. Yeah.
How do we fix it?
Well, this is, I think I'm going to stay in my lane about what I control. I mean, I have ideas for, I think, political messaging and how we need to be encouraging the youth. But
what do you think would be effective there? Actually, I'm curious to hear, because I've thought for a long time, like on an individual level, I know how to help people with health, nutrition, physical fitness, strength training, getting in shape. I've helped a lot of people on an individual basis with that. I have no idea how it could be fixed at scale. I don't know.
I'm going to talk about Charlie Kirk actually here because I think he did something incredible. I know, it was for the conservative movement in the US, and he was out at colleges and he had different chapters, at all the colleges around the US. He had chapters at high schools. And so, his message really was one of, faith, community, responsibility. And so I think you can have grassroots movements. I think you need to have passionate individuals reaching out to people and speaking the truth. And so I think you can do it on that level, going out and talking to people, because like where do we want this information to come in? Ideally we want it to come in school. All those things that you talked about, purpose, health, relationships, people should be learning about the building blocks to a happy life at school. And so I think getting out to the schools is important. I have mad respect for Bobby Kennedy as well, and like all of the hate that he's getting. But I think having leaders stand up and speak truthfully about the importance of health and whether it's God or work or relationships, and taking responsibility. I think we need brave people to stand up and share that message, and to not cower from the intimidation of the media when you say these things like that, and they try and say you're a terrible person and you're unempathetic because you're bringing these points up. It really is just to shut you down, because the most loving thing is to make someone feel hopeful and that they have a chance to change their life, and they don't need to just stay on drugs. And so that's what I would like to see as a political movement,
public message.
Happening around mental health. What do you think? I know you mentioned you thought a lot about it. Like, how do we fix this?
I really don't know at scale. And I've asked this question to my audience on X before, and people are like, Ozempic. And I'm like, good grief.
Yeah.
Like, please don't tell me that's like the only scalable solution.
Yeah.
I genuinely do not know.
Yeah.
I think what you just said makes a lot of sense, the sort of bottom-up approach. So, because the problem is, like, even the people in power, the public health officials, like everyone's out of shape. No, people aren't healthy.
Yeah.
Right.
Yeah.
So I often say that you can't teach something that you don't know yourself.
Yeah.
If I don't have some information, I can't teach it to anybody else. And when I look at, the people in the halls of power, not just in this country, but other places, even the, health ministers, so-called health ministers often, right, they're in terrible shape. They don't exercise, they don't eat well. So it's like, well, how are these people going to get the nation healthy? It has to be, we need the bros. Like, we actually need, you need more bros in these positions somehow. Maybe there needs, I don't know. I'm also like a small government guy. So anything that's like, we need this like whole new department or something, I'm like, I don't know if we want that.
It's such a good list.
I think it needs to be, the priorities need to be shifted somehow. And I'm sure with the right thinking and with the right funding, there could be a way to move the message more into the mainstream. I'll tell you what might be needed. And this might be one of the things that actually makes it quite complicated, which is that I always think it's very hard to do many, many things and to keep people's focus on many things at once. So it's hard to push and promote and get into the public consciousness a message about health, right? Taking care of your body, avoiding obesity, metabolic health issues, everything that's downstream of that. It's hard to do that while also having a massive conversation about crime and the border and taxes and this and that. And that. So I think there would need to be an administration, let's say, where like this is like one of two or maybe three massive topics that, okay, for the next 4 years, for the next 8 years, for whatever, this is the issue that we are prioritizing. But with all these other problems going on that are more urgent, I think even with a lot of effort, it falls in the back, because in the same way that like in the news media.
Yeah.
Right? Like the way one story supplants another one. You can't have everyone simultaneously caring about the same like 10 different things.
I had an idea while you were talking to me, an idea that is a very American idea because it's about enterprise and making money for people. So, and it's come to me from the schooling system. So there's a lot of criticism about like the value of college and even the value of high school. Mm-hmm. It's like, if you're an entrepreneur, I'm an entrepreneur. I mean, I think you quickly will recognize that work is about solving other people's problems. Mm-hmm. And if you can find a problem, you can fix it. And you can fix it, you can make a living. No one gives a shit whether you went to college or anything like that. If you just do a great job at it, they will come and find you. And so out of that, a school system formed not so long ago in Texas called the Acton Academy, which could be a really cool thing to look up. Okay, this is an entrepreneur-based school. So kids like in middle school and high school, they are already doing internships with different professionals around the place. They are encouraged to find problems out there and to think, and not to be like, oh, I have to learn calculus or I have to learn history or I have to just like write these essays. It's like, what problems can you see out in the world that you want to fix? Mm-hmm. Okay, maybe you're interested in medicine. Go and like shadow a doctor. Maybe you're interested in law. Go and see if you like that. And it's essentially about fixing problems. And they have they have like fairs where the kids will they'll build a product or they'll sell a service and they have to market it. And then they'll advertise it to the parents and the communities and they'll get real feedback as they're growing up on like how they're doing in marketing and, you know, whether their product is actually good or not. So I think like you could in the US, you could have schools like the Acton Academy where they're like, you know, here we are about like faith, we're about entrepreneurship, and we're about health. Mm-hmm. Like a lot of Americans are sick of the public school system. Like the rate of people choosing alternative schools and homeschools right now is huge. And so if someone were to create this kind of schooling where it's like, hey, this is what we believe, if that's popular and if that makes money, that's going to expand. And so I think you could also do it from an enterprise perspective and build out just a new way of schooling and educating kids that's in line with this philosophy that's really going to resonate with people. And then if you start to get great results, it will expand.
I think that's a great idea.
Yeah.
Is there anything we have not talked about that's on your mind?
No, I mean, we have covered a lot.
Covered a lot.
Yeah.
I thought so. Dr. Josef, man, dude, I appreciate and respect what you're doing so much.
Yeah.
Continue to do your great work with helping to get people off these psychiatric medications, continue to speak out and just spread the word and spread the truth about what is going on in the USA and beyond in all of these issues. And I hope other people will be inspired. I hope other people in your field will start to ask some of these questions and have the boldness to recognize, you know, not just notice that something is wrong, but be willing to go to the public and, you know, talk about it and raise up these issues, man. But you got my respect, man. Thank you for the gift of your time.
Yeah, no
worries.
Wisdom. Thank you for having me. I'm so happy we were able to make this happen.